We represent over 300 member companies, all gathered in a single cause, which is the recognition that the country's future depends on more broadband to more people. This is one of those great issues that I think does and must always transcend traditional political ideology. The interesting thing is it's not one of those issues where we need a whole laundry list of things for the government to do, in my judgment. But we do need to recognize the changing nature of the communication marketplace and be vigilant and sensitive to the ways in which government and policy can either facilitate the positive investment in the infrastructure and the positive incentives for citizens to adopt it, and those things that it might take that could distort or thwart that. The U.S. is doing well, but it is behind, and we can't afford to have too many mistakes along the way.
Over the last 10 years, broadband providers have invested upwards of $500 billion of private capital in ensuring that this internet ecosystem works for every American and that we provide access in as broad a way as we possibly can. As we sit in this room, some 3 million jobs are supported by the internet. The policies that you effectuate, the policies that are voted on here, the policies that are developed here. 3 million jobs, and if you consider the entire high-tech industry, the number reaches somewhere near 6 million jobs. If there's one area of the economy that continues to grow in terms of job creation, it's broadband, it's the internet. And if we are able to find ways in which to provide the kind of certainty that internet service providers and broadband companies need, the kind of jobs that can be created not only in your states, in your respective districts, but for that matter, the way it will make us even more competitive as a nation will benefit us not only today, but going forward. One of the things that we have seen without doubt over the last several years in any industry is that when there is certainty in that market space, more investment flows there. Private investment flows there, and private investment in many ways drives economic prosperity and drives job creation, which is one of the reasons, if not the most important reason, from my perspective, that BFA plays such a critical role in helping policymakers, and for that matter, as Michael said, policymaking aficionados, so important to this conversation.
Today, we're in an environment where over close to 70% of Americans have broadband, and the ability to get better broadband in more places, in both the mobile and the fixed environment, and to get more people to use it with more applications, I would argue is critical.
I couldn't agree more with you, Rob, that broadband is not a luxury, it is a necessity. And that's why I started Project Goal, because one of the statistics you mentioned is that almost 70% of adults are online, have broadband at home. But of our older adult population, 65 plus, it's only around 37%. So what that means is a great number of our older population don't have the benefits of broadband today. And those benefits are huge. First of all, benefits in the health area, mental health, physical health, searching for health information, connecting with family and friends, social networking, e-government. So many government forms have moved online now. And so it's not only a convenience, but in some cases it's a necessity to be able to go online and do some of these transactions.
A lot of times when people think about broadband, they don't connect it with health, but it really does have a practical impact on healthcare in America. And I can tell you, the broadband report from last year was referenced, and I think that some of the current proposals that came out of that report that are being considered by Congress, both on a funding and a policy side, are going to have real practical implications for healthcare delivery now and increasingly in the future. And so the success of broadband is tied fairly directly to new and cutting-edge healthcare applications that I think need to be fostered. We're facing a real access problem, particularly in the Medicare program. There's about 48 million Medicare beneficiaries right now. By 2020, there's going to be about 60 million. By 2030, there's going to be 80 million. These people are all going to be seeking physician services, and the number of physicians available to these beneficiaries is actually going down. So is the number of nurses. By 2020, there's going to be a million nurse shortfall. And so as the population increases, the supply of professionals is going down. These people have to get access somehow. Telemedicine and interaction through either an email consult or online consult, broadband enabled, is a perfect way to help ease the access problems.
In so many ways, I view the issue as a nonpartisan one, one that should not be viewed through any prism of Democrat or Republican. The fact is, without information or access to it, without a system that can support it, we can't compete, whether your idea is a great Democrat one, a great Republican one, a great conservative one, or even a great liberal one.